Before we get started, it is worthwhile just to go back a little bit to high school anatomy and to at least be able to picture various parts of the gastrointestinal tract. Doing this makes it much easier for you to understand the concept of the tubes and the bags. Now, I'm not going to discuss all 24 noted parts of the gastrointestinal tract, but I just want to discuss a few of them, which will give you a greater idea as we go forward. First of all, I want you to look at number 3. That is the esophagus, which I'm sure most of you know, which is also commonly referred to as a food pipe. That goes from your mouth down into your stomach. The second thing I want you to look at is number 20, which marks the upper part of your stomach. The next thing I want you to look at for anatomically is the small bowel, which just look at numbers 6, 7, and 8, and that reflects the small intestinal tract, which you might remember includes 3 parts: the duodenum, the jejunum, and the ileum. Next, I want you to look at numbers 13 through 17, and that basically is your large intestinal tract, also known as the colon. Then finally, look at numbers 11 and number 10, that is the rectum, or the end of your large intestinal tract. And lastly, number 9 is your anus. Now, the gastrointestinal tract measures in adults about 20 to 30 feet. So it is a very large and very long organ with many different parts to it, but the most important are the parts we just discussed. Now, it's really great if you understood or remembered some words which refer to the gastrointestinal tract, because many of these words or pieces of words are put together to describe aspects of tubes and aspects of the bags. First thing is when we talk about the food pipe, we usually use the term esophago. When we talk about the stomach, we use the term gastro. When we talk about the small intestinal tract, we usually use, generally speaking, entero, but it can be broken down into the 3 areas we talked about in duodeno, jejuno, and ileo. When we talk about the large intestine, the parts of the word we usually use are colo or ceco. Some other words to understand: there is a term called enteral, which perhaps you've heard about when it comes to nutrition, and that just indicates the involvement of the whole GI tract. So enteral nutrition is nutrition that goes into the GI tract. The next word you will not hear about frequently, but it's called parenteral, which means other parts of the body other than the GI tract, and usually that implies things going into your intravenous system or the veins, as in parenteral nutrition. The word ostomy just basically means an artificial opening at any organ of the body. And lastly, the stoma is the actual part of the intestinal tract that is brought out through the abdominal wall and visible on the skin, which is basically the hole in your intestinal tract. So if you understand or can remember some of these parts of words, it'll make it much easier for you to understand things related to tubes and bags of the gastrointestinal tract. Now, the first question one may ask is, why would we use a tube or a bag in the gastrointestinal tract? And there are a couple of reasons. The first big reason is to allow things to get into the GI tract. As noted in the first bullet, tube feeds are a simple way to provide nutrition and fluid into patients who otherwise are not getting enough. And I listed different types of diseases and why a patient would use a tube. As I noted in the second bullet, sometimes patients just can't tolerate a large amount of food or formula at one time. It overwhelms their intestinal tract. So the tube enables you just to supply small amounts continuously. This is called drip feeding. Tubes can be used to give patients nutrition while they're sleeping at night, or a few extra times during the daytime. And sometimes tubes aren't even used for nutrition, but it's used to give patients medications that they cannot successfully take via their mouth. The second thing as to why we would use a tube or a bag, in this case mostly a bag, is to allow things to come out of the gastrointestinal tract. Food will go in, but things, basically feces and other fluids, must come out. Sometimes when you have processes such as obstructions in the intestinal tract or you're missing part of the intestinal tract, you need to use a bag to allow stool and fluids to come out, and rarely some gas. So these were the two major reasons why we need tubes and bags: to allow things to get into the gastrointestinal tract and to allow things to come out the gastrointestinal tract when one of our patients has some disease preventing that from occurring. Now, the next thing I want to start discussing is types of tubes. I'll go into more detail over the next few slides, but I just want you to understand a couple of things. The concept of nasogastric tube. Naso means nose, tube that goes into the stomach from the nose. There's nasojejunal tubes that go through the nose into part of the small intestinal tract. There are gastrostomy tubes. Remember, gastro means stomach. Ostomy means hole. That means you have a hole going into your stomach, and a tube gets placed in that to allow things to go into those. The last few things listed will be rarely, if ever, seen at HME, so I'll just pass on those for the time being. So first, let's talk about the nasogastric tube. As you can tell from the picture, the tube goes through the nose, down into the stomach. It can be placed in on a daily basis and then removed. This is usually used for short-term situations when a patient can't swallow enough for whatever reason. Again, this is unusual for HME to deal with because we will deal mostly with chronic patients, in which case an NG tube is usually not used, though it can be rarely used in certain situations. So if you hear the term nasogastric, that means a tube that's inserted in the nose and is slid down into the stomach. A second type of tube similar to that, again used very rarely, is called an NJ tube, which is a nasojejunal tube, which again is slid through the nose, slides down to the stomach, but slides even further past the stomach into the small intestinal tract. This is usually used when there's a blockage in the stomach or the first part of the intestine where food can't get through, but the tube can't pass. Again, this will be rarely done on a home patient, but you might see this. And again, this is an NJ, or nasojejunal tube. Now, the tube you will see mostly is something we call a G tube, or as we discussed before, a gastrostomy tube. Now, this is an interesting article or slide I had seen. I guess this is not an absolutely new thing, as this picture comes from 1888 with a patient having a G tube, a gastrostomy tube. Now, how they placed it surgically in 1888, I'm not sure, but it just shows G tubes have been around for a long time. Now, in this slide, I want you to focus mostly on the bottom three pictures. When it comes to G tubes or gastrostomy tubes that go into the patient's stomach, there are usually two main types. There is one with a balloon on the end, and that's the part that goes into the stomach and holds the G tube in place. The second one is a non-balloon type. Now, the most common non-balloon type is called a BARD tube. The most common type of G tube with a balloon is called a McKee tube. So you will most likely hear these two types of tubes, which we might help to supply. When you hear about these tubes, usually you're given two numbers. One is the size of the width of the tube, called French, and for a child, they will have something usually along the lines of a 14 French tube, and for an adult, they will have a larger tube, which is called an 18 or a 20 French tube. The 18 or 20 French tube is wider because the hole is usually larger in an adult. The second number you will hear will be in centimeters, and that is the length of the tube. So to reiterate, when it comes to gastrostomy tubes, there are usually two types, one with a balloon, and it's most commonly called a McKee tube. The second without a balloon, most commonly called a BARD tube, and you'll hear two numbers, the width of the tube, which is in French, and the length of the tube, which is in centimeters. The next slide is just an interesting slide, and it is something we will not usually see or hear about at HME, but nowadays tubes can be placed non-surgically with an endoscope, and I did many of these in my career. This is where I place my scope through the patient's mouth, slide it down into the stomach and shine the light at the end of my scope. You can then see the light shining through the abdominal wall, and I would stick a needle through the abdominal wall towards that scope. And once the needle gets into the stomach, I place a wire through that needle, because it's a hollow needle, into the stomach, and that wire would be tied on the outside to the gastrostomy tube. I then pull the wire out through the stomach, up the food pipe, up the mouth, and with that I would pull the gastrostomy tube into the stomach. It's just one of the ways to place a gastrostomy tube called a PEG, percutaneous endoscopic gastrostomy. Other ways to place a gastrostomy tube are surgically via a surgeon. Just something interesting. So if you ever hear a PEG tube, this is what it means. Now, once you take a look at this one, you may hear of something called a G-tube or gastrostomy tube button. This is where after a period of time, after the gastrostomy tube has been placed into the stomach and the track into the stomach is healed, you can pull out that longer gastrostomy tube and place this low-profile button, which barely protrudes from the surface of the stomach. Most patients, pediatric or adult, who have long-term gastrostomy tubes will have these buttons placed. So if you ever hear a G-tube button, this is what it looks like. Now at HME, we'll be responsible for delivering supplies to patients who have mostly G-tubes, who need to get their nutrition. Some of these supplies includes the pump, and there's actually a video on the internet about pumps, which I did last year. Other things that you'll need to know about when a patient has a gastrostomy tube is what type of tube or button do they have and what the size is. Remember, we discussed that. It is a Bard or McKee gastrostomy tube, and what is the French size and what is the length. You will be asked, or we will be asked at HME to deliver the pump sometimes, the tubing, the feeding bags, and the formula. Many times we'll deliver it to the hospital room and train the patient, and then it'll be delivered to the home afterwards. And with the pump, the patient could control the rate of the feeds getting into the tube, and they will get this pump to use at home. And lots of times they can then deliver the formula on a very slow rate on the drip that we had discussed about. So if a patient has a tube in place, these are the things that we will be supplying them at HME. Now let's talk about the bags. Now many times a patient will have an ostomy performed, usually in their small intestinal tract, and this is usually done because there's an obstruction further down the gastrointestinal tract, and so stool and liquid needs to be relieved prior to the obstruction. Or sometimes a patient will have part of their intestinal tract, usually the colon, removed in a surgical procedure called a colectomy, so you don't have stool being able to go through the large intestinal tract, so you have to create an ostomy in the small intestinal tract to allow things to happen. This is a picture of an ileostomy. As we said before, ileo